So we are discussing the drugs which are used to treat cough. Here I would like to tell what are the specific approaches one should follow while treating the cough. Because cough can have multiple reasons. There are so many reasons why the cough occurs. So any patient who comes to us with the cough, we are only give the cough suppressants and send the patient home. But sometimes this can be harmful to the patient. So we have to treat the underlying cause. What is the exact reason why this cough is occurring? And we have to find this cause and then we treat. So we have to properly thoroughly take the history and examination, and then we will underline cause will be find, and then we will treat that underlying cause, and then the cough will go away. For example, if the patient comes with him some symptoms of headache, running nose, and headache, running nose, and like sometimes some patient may have dry cough and sinusitis. So these are the symptoms of upper respiratory tract infections. And also some patients can have cough. Along with cough there is a lot of sputum, and sometimes patient can have fever, chills, and cough with sputum production, and these are the symptoms of lower respiratory tract infections. And if the infections component is adding to the cough, then what is we are going to do then? As we know, if infection is occurring, then we have to give the antibiotics to such patients. So here the antibiotics will help. So these types of cough require antibiotics. Then sometimes the patient are quite chronic smoker, and they keep on smoking, and this smoking and sometimes the patients are exposed to a lot of pollution, and this pollution and these smoking particles are very much irritated for our respiratory passages, and in the respiratory passages they cause the inflammation in our respiratory tract, and this inflammation in the respiratory tract leads to chronic bronchitis also. Chronic bronchitis. So these patients who are exposed to smoking, pollutants, and chronic bronchitis, these the treatment or the cough in these patients will be treated with curing the smoking. They have to cure the smoking. They have to avoid the pollution. They have to cure the smoking. They have to avoid the pollution also. And in some cases, because the component of bronchitis is there occurs a lot of inflammation in their bronchus, so we have to give steroids for treating the cough in these individuals. And sometimes because of the bronchitis there occurs a lot of bronchospasms, their airway becomes very much narrowing, and they're having difficulty in breathing, and that can contribute to cough also. For that we also require the bronchodilators, and sometimes the steam inhalation will also help in such cases, steam inhalation. And their cough that will then be very much improved with such approaches. Some patients can have cough because of the abnormal airways, like a condition called as bronchiectasis. What happens in bronchiectasis? The large airways of the respiratory tract become very much dilated, and these dilated airways are predisposed to a lot of infection, and they collect a lot of sputum in them, and a lot of mucus get collected in these dilated airways, and this mucus and sputum irritate these respiratory passages, and patient can have a lot of cough and sputum in bronchiectasis. Here we can see the CT images of the bronchiectasis changes. Here we can see the lot of dilated airways, and here the X-ray findings of dilated airways where the mucus get collected, and this collected mucus irritate the air passage again and again, and the patient can have cough. So the cough suppressants will not going to help such cases, as we know that a lot of sputum is collected, and on the top of that if we give the cough suppressants, the sputum remain collected there, and the patient cannot cough, and this mucus collected mucus will get again and again infected, and the patient can have again and again cough. So for that cases of bronchitis we require the chest physiotherapy. Here we require the chest physiotherapy, and along with chest physiotherapy we require the postural drainage. So postural drainage and chest physiotherapy will help with the help of gravity these sputums get removed from their respiratory passages. Here we can see if you have the bronchiectasis or the changes occurring in the upper lobe of the lung. Here we can see on the anterior and upper lobe are affected. Here the posterior and upper lobes are affected. So here a lot of sputum is there, so this sputum has to be removed. So what we can do, we can change the position of the patient. This is the postural drainage I am talking about. So we will keep the patient in the semi reclined position, and this will help to drain this mucus. Here the mucus from the upper lung will go down with the help of gravity into the main respiratory passages, and when it reaches the main respiratory passages, and as the patient cough, this will remove from the trachea. So in this way the gravity will assist in this case. Similarly here, if the posterior and the upper lobes are affected of the lung, the patient should be keep in leaning forward position. Here we are going to keep the patient in leaning forward position. And if the posterior and lower lobes are affected, the position of the patient should be prone with head towards the downside, and as a result of which this lot of sputum will go in this direction and it will come in the main respiratory passages, and from here the sputum will move out and the irritant sputum will not be there and the patient get relieved of cough. And also if the patient having the lot of sputum collected or dilated bronchitis changes is seen in the here we can see in the right side of the lung, then you have to keep the position like this in the left side down, and from the right side the secretions will go down into the main respiratory passages. From here they are removed. Similarly, if the left sides are affected, the patient right side should be down, and from the left side the secretions will go into the main passages and from here it is removed. And if the again if the this is the if the anterior and lower lobes are affected, you have to keep the position like this, the head towards the down, and the patient should be in supine position, and this will track the sputum in the main respiratory passages as we can see, and it is removed from the main respiratory tract, and because of which the patient will get a lot of relief. Here the cough suppressants will not work. Here the chest physiotherapy and the change of position of the patient will help in clearing the sputum from the respiratory passages. Some patient can have cough from a long period of time. As we know, when a cough for more than 2 weeks along with low grade fever, these are the symptoms of pulmonary tuberculosis, which is very common in India, and we know that this pulmonary tuberculosis can also cause cough. And for treating the pulmonary tuberculosis, the normal cough suppressants will not work. We have to treat their bacterial infection that is caused by Mycobacterium tuberculosis, and for that we know we have the drug therapy as known as the anti-tubercular therapy, which is given for a period of 6 months. So anti-tubercular therapy where it will work here, and we prescribe this anti-tubercular therapy or ATT for a period of 6 months, and then their cough will go. Some patients can have allergies in their nasal passages and in the sinuses, and these sinuses sometimes get infected, and there are allergic component in the nasal passage, and there are a lot of secretions which trickle down from the sinuses and the nasal passages down the throat, and this is called as this is post nasal drip. This postnasal drip can has also patients presents with cough symptoms, like they have constant desire of trickling the secretions down the throat, and that can irritate their respiratory passage, and the patient can have repeated cough again and again. So in such cases, since infection we will give the antibiotics to treat their sinuses infection. In the sinuses we give the antibiotics, and also because allergy component is there is a lot of histamine produced, so we have to prescribe the antihistamines to these individuals. Also, since the nasal passages are a lot of congestion in the nasal passages, we prescribe them the nasal sprays that contains the decongestants. So we prescribe them nasal sprays that will decongest their nasal passages, and they will be relieved of cough because of the nasal decongestants. Sometimes they may require the corticosteroid also to treat the inflammation occurring in their sinuses and in their nasal passages. In some patients, the cough is due to acid reflux that can move from their gastrointestinal tract into the esophagus, and this acid will irritate the respiratory passages, and that can cause cough. And this condition is called as the gastroesophageal reflux disease, and this is because of the production of lot of acid in their stomach. And for cough due to gastroesophageal reflux disease is treated with proton pump inhibitors. Proton pump inhibitor will work better here, and the drugs like Pentop we will give to treat their cough. And acid suppression can also be done by H2 blockers like your famotidine. And also you can increase their gastrointestinal motility. For treating their cough, we will give the drugs that will increase the motility of the gastrointestinal tract, and the drugs here that increase the motility include your mozapride and levosulfide. Besides these drugs, we also advise the diet modification in patients of gastroesophageal reflux disease. Diet modification, like patients should avoid eating tea, coffee in the evening, and they should avoid smoking, and that will help more in these patients. Also, we have to, while sleeping, their bed hand should be head end of the bed should be elevated. Head end of the bed should be elevated. That will also provide some relief in the cough in patients of gastroesophageal reflux disease. And one more condition we know that asthma is a hypersensitivity disorder of our tracheobronchial tree. It is a hypersensitivity of the respiratory tract, hypersensitivity of the tracheobronchial tree, and that can cause cough. And the patient with asthma usually have seasonal variations, and they can also have cough. Along with cough, their bronchi are very much constricted. Their bronchi are constricted, and because of which they have lot of wheeze and dyspnea. They have difficulty breathing, and they are also having the allergy and inflammation. So for cough of patient with asthma, we require to treat their allergies, inflammations, and all the component of bronchospasm. For that, for bronchospasms, we have the drugs like we give the beta-2 agonist in the form of salbutamol. We will give the beta-2 agonist, and then for their inflammation, we have the drugs like corticosteroids. We will advise the corticosteroid to control their inflammation. For allergy, since there is a lot of histamine produced, we will give the antihistaminics to the patient like levocitrazine, antihistaminics like levocitrazine. So in this way, the cough in patients of asthma will be treated. So there are certain drugs that can also cause cough when given for a long period of time. For example, your angiotensin convertase enzyme inhibitors. For example, the drug in this group is ramipril. These drugs can cause the cough. So first we understand why these drugs are given. These drugs are angiotensin convertase enzymes. So we'll see the normal mechanisms. Normally, what does the angiotensin convertase enzyme do? It will convert your angiotensin 1 to angiotensin 2, and this angiotensin 2 then works on the blood vessel. So it will work on the blood vessels. So normally the blood vessels are dilated, and because when the angiotensin 2 will come, these blood vessels become constricted. And that will increase the blood pressure. Because of the presence of angiotensin 2. So when we give ramipril to the patient, it will inhibit this angiotensin convertase enzyme. So angiotensin 1 will not be converted to angiotensin 2, and the action of angiotensin 2 will not take place. That is, it will not constrict our blood vessels, and because the blood vessels are not constricted, and therefore the BP will not increase, and the blood pressure will fall down. This is normally we prescribe ramipril for reducing the blood pressure. So in addition to the conversion of angiotensin 1 to angiotensin 2, the angiotensin converting enzymes will also degrade one enzyme known as the bradykinin. It will also degrade the bradykinin. And we should be knowing that, and we also know that this bradykinin works on our respiratory passages. In the nerve endings of the respiratory passages, what does this bradykinin do? Bradykinin irritate these nerve endings of respiratory passages, and because of the irritation of these nerve endings, this will result in cough because of the presence of bradykinin. So as we give these enzyme inhibitors, these angiotensin converting enzyme inhibitors like ramipril, it will not be able to degrade this bradykinin, and as a result of which there is production of lot of bradykinin, and this lot of bradykinin then work on our nerve endings in the respiratory passages, and that will cause cough. So in this way, these drugs ramipril will cause cough. So if the cough is occurring because of these drugs, we have to stop these drugs, and we have to substitute these drugs with drugs like your angiotensin receptor blocker. These are the drugs that will work here. It will work directly on the receptors of the angiotensin 2. The drugs in this group, we have the drugs like telmisartan, losartan, telmisartan. These will help here. So if the cough is occurring because some patients are taking having blood pressure, and they are taking these drugs quite frequently, so we have to advise them that you should stop taking these drugs, angiotensin converting enzyme inhibitor, and we will switch them to drugs like angiotensin receptor blockers like telmisartan, losartan. So these drugs will work there. And sometimes the patient can have cough because of the viral infection. These types of cough are the post-viral cough. For post-viral cough, usually no treatment is required, no specific treatment is required, and these type of cough is subsides by itself. So there is no specific treatment for post-viral cough, no specific treatment, and they will subside of its own. So these are the approaches of how we are going to approach and treat a patient who comes with cough.